Welcome to Medical Myths, Legends, and Fairy Tales. I'm your host, Dr. Alan Christianson. Look, you know that between the latest online fads and the crazy media headlines, it's easier than ever to get confused about your health. And you and I just want to feel better and live longer. We want to know what works. And we can't wait for further studies. We need to make decisions today based on the best evidence we've got. Well, that's exactly what this show is here for. So let's get to it. Hey, Dr. C here. So how are your adrenals doing? What are your cortisol levels like? You know, they're important to your health. Your balance of cortisol, the rhythm, the HPA axis can be one of the biggest predictors of your longevity and your well-being. Having said that, there's been a lot of confusion and misinformation about fatigue always being caused by cortisol, or about people needing to take cortisol to help with fatigue issues, or even low cortisol levels on labs being the result of the body not being able to make cortisol. So to talk through this, I've brought on a dear friend, Ari Whitten. He's a 2-time best-selling author and founder of the Energy Blueprint System. Ari's a PhD in clinical psychology and doing master's work in human nutrition and functional medicine. So I know he spent a big chunk of the last year or so going deep in all the literature on all things cortisol. So after coming out of that, he and I did a quick debrief and wanted to get you all up to speed. So please enjoy this time with my friend Ari. Hey, Dr. C here with you, and this is going to be a blast, joined by my friend Ari Whitten. So hey, Ari, welcome aboard.
Hey, Alan. It's such a pleasure and an honor to be here. Thank you for having me.
Well, this is a topic that we've talked about a lot on hikes and in discussions. So great thing to share this with the audience, and you've read a bunch on this too. So let's quickly just talk through about, the adrenal fatigue idea and dismiss that, then talk about what we've got behind it and like all the different layers you were mentioning. So adrenal fatigue, what do you got to say?
Yeah. Okay. So I'll give a super quick summary of the basic idea of adrenal fatigue so we can kind of get into the literature around testing this hypothesis. So the basic idea, it really comes almost from Hans Selye's work back in the 1930s to 50s, kind of that was the origin of it. And then there was a guy back in the 70s, I think his name was, and I know that you know his name was Jeffrey Smith, I want to say, something like that.
Yeah.
And
so
this basic theory's really been around for a very long time. And kind of the basic gist of it is we have adrenal glands that produce a number of different hormones, but in particular, the focus has been on this hormone cortisol and its role in the stress response. And the basic idea of adrenal fatigue, it's kind of pretty straightforward when you think about the name, but it's basically that chronic stressors of various kinds tax this system. They tax the adrenals, they tax this cortisol response. And over time, when that's happening, when that chronic stress load is there chronically for months, years, decades, it basically wears out the adrenal glands so they can't produce enough cortisol. And the lack of cortisol or the abnormal cortisol rhythms, there's kind of lots of nuances here that I'm sure we'll get into, but the oversimplified version is the lack of cortisol eventually translates into various kinds of symptoms. So fatigue, obviously, that's, adrenal fatigue is sort of conceptualized by many people as the cause, quote unquote, of fatigue. Depression, anxiety, brain fog, low libido, blood sugar dysregulation, poor sleep at night, cravings for sugary or salty snacks, and a few other different symptoms. And it sounds like, pretty well. Actually, I'll mention kind of a little bit other layer to this story. So it's often conceptualized as 3 phases of adrenal fatigue.
Can I expand just really briefly about Dr. Jeffries' work?
Yes.
Yeah. So William Jeffries.
William Jeffries. Yeah.
William Jeffries. Yeah. So safe uses of cortisol. I stumbled across this book in the early days of my practice. There was a compounding pharmacist friend who introduced me to that. And the argument was that many people with these garden variety symptoms had a syndrome that could be improved by taking cortisol supplementation. And Dr. Jeffries' work spanned the earliest days of synthetic glucocorticoids. And this was put out in his later years. And in the early days of making prednisone and prednisolone and some of these early compounds, they were wonder drugs. It was like people would feel radically better. They would cure all inflammation. And Of course, as data emerged, they found out that there was quite a bit of cost for this. There was a lot of harm to the body. But I think some that were around in those early times had a hard time shaking the possibility of there being some benefit in some way. And so he argued that these conditions could improve with more physiologic doses. And he argued that if you would take a dose that was within the range of what the body would make of a cortisol analog, that it really wouldn't have the risks from that. And we now know that's not likely true, but for sure this was like a big underpinning of this model that grew into adrenal fatigue.
Yes, yeah, and even Hanselier's work. I mean, a lot of the people, the proponents of adrenal fatigue in the 2000s, are referencing Selye's work from the 30s to the 50s. But the basic idea, again, chronic stress wears out the adrenals, results in low cortisol. The more sophisticated versions kind of conceptualize 3 phases. Sometimes you see people saying there's 5 phases, sometimes 7 phases of adrenal fatigue, and they can be in Selye's work. They were initially sort of characterized as the acute alarm reaction, then a resistance phase, then an exhaustive phase. I've heard people refer to them as, sometimes you hear people just say phase 1, phase 2, phase 3, or they say acute phase, compensatory phase, exhaustive phase. There's various names depending on who you ask. Interesting fun fact, I don't want to jump ahead too much, but there's basically zero scientific support for any of these different categories of phases. There really is no solid evidence supporting this sort of progressive series of events as far as how our adrenals are responding. But I'm sure we'll get there later. But that's the basic idea of adrenal fatigue. And, I think the broader picture of this landscape is kind of interesting. And I've been excited for this conversation because I think, obviously you're super well read on this topic, and I've spent literally a year of my life doing nothing but digging into this literature because I had such a hard time making sense of all the contradictory data. I eventually just settled on not trying to make sense of it with some grand summary, but just presenting, like saying, here's the numbers of the studies that showed this result versus that result and this result, and we'll get into that. But, this broad picture of the landscape is we have everything from people in the natural health space, naturopaths, chiropractors, functional medicine doctors, who absolutely swear adrenal fatigue is a completely real thing, who diagnose people with adrenal fatigue on a daily basis, who conceptualize adrenal fatigue as the cause of chronic fatigue and many other conditions. And we have also some genuinely good data, as I know you've talked about, around HPA axis dysfunction and how that correlates to various diseases and symptoms. And then we also have, so everything from kind of that to the Endocrine Society, which represents 14,000 endocrinologist MDs, where they've come out publicly and said, and this is a quote, adrenal fatigue is not a real medical condition. There are no scientific facts to support the theory that long-term mental, emotional, or physical stress drains the adrenal glands and causes many common symptoms. There was in 2016 also a systematic literature review, which is highest level of evidence, that reviews all the available evidence. And the title of it was Adrenal Fatigue Does Not Exist. So if we can kind of conceptualize this as like many people in the natural health community swear adrenal fatigue is totally real, diagnose people with it, imagine that it's this huge epidemic, and think anybody who questions it is an idiot. And then you have the conventional endocrinologists who are saying anybody who thinks adrenal fatigue is real is a quack. So I think there's a lot of really interesting nuances to the middle ground. And, I just thought that kind of that big picture frame of how medical experts think about this would be useful to kind of ground this whole discussion in.
Well, an important point too, which I think we won't need to go into per se, but just to illustrate something, is that the question becomes, what is one's epistemology? What is one's way of deciding? How does one arrive at conclusions? And the difficulty is that it's so tempting to make conclusions based upon our personal experiences. What seemed to help me personally with my own health, or what seemed to work for my patients, or what I got feedback about. And it's hard to shake from, I guess, like a folk epistemology or a natural way of forming conclusions. And those things are very convincing. And there's a lot of ways by which, we can't ignore our own apprehensions and our own experiences, but yeah, they can mislead us.
Mm-hmm. Yeah, you're absolutely right. I think, on a sort of deeper philosophical level, how one approaches and evaluates and interprets the data that they're seeing matters a lot. I mean, there's a lot of examples of, natural medicine doctors or functional medicine doctors who in their clinic on a day-to-day basis will test people's cortisol levels and see certain abnormalities, and then their interpretation of those abnormalities, oh, this is adrenal fatigue. So they're not even necessarily aware in many cases that there are alternative ways of explaining that particular cortisol abnormality that is outside of just the basic adrenal fatigue theory. Chronic stress has worn out your adrenal glands.
Well, and then they could have patient feedback saying, thank you so much for finding this. I now feel better. I've done these various steps. They've been helpful for me. And that's hard to see past sometimes.
Yes, absolutely. So I'll let you kind of decide where we go from here. I think here's kind of a framework for what I think would be helpful to build out some of these layers. So one would be just kind of a straightforward examination of, is adrenal fatigue a real thing? And is it the cause of chronic fatigue conditions and the symptom of fatigue? And there's a huge body of data there, as we said, from Sellier's work and William Jeffries in the 70s. This idea has been around for a long time. And fortunately, researchers all over the world have actually tested it, with really good studies over about 25 years. So we actually have lots of data there. Another layer to the story is like, to what extent is adrenal or cortisol abnormalities, are adrenal and cortisol abnormalities or HPA axis dysfunction a key driver of chronic diseases more broadly? That's a pretty big discussion, but we can certainly go there. And then to what extent is chronic stress actually linked with any kind of wearing out of the adrenal glands? Is the basic idea of the adrenal fatigue theory valid or not? So there's kind of a few layers that we can go into, but I'll let you kind of direct where we go.
I think the last thing you mentioned and also the first thing relate together as far as more like the pathophysiology of what's thought to be adrenal fatigue. And I don't know, I can point to links to your work and my work that go deeper in that. I'd love to hear just more open-ended about what some of your observations have been from going through all this.
Yeah, well, so I will say that background story on me, I was, I've been in natural health studying nutrition and fitness and exercise physiology and natural health more broadly for over 20 years now. And I was absolutely a hardcore believer and proponent of adrenal fatigue for many years. All my mentors and the health experts that I was reading books from were all talking about adrenal fatigue. If there's, dozens of books being written about it, thousands of articles online about adrenal fatigue, of course, my assumption as a young kid just learning health science is, of course, this stuff has got to be real and supported by lots of good evidence. It wasn't until many years later that I discovered, as I mentioned before, that within the conventional medical community, they consider the whole story of adrenal fatigue to be quackery. And
was there a particular thing you came across or piece of data or perspective? Or was there any memorable thing that nudged you to be receptive to that belief? Because that was available, but was there something that shifted that or?
Well, so the reality is we're talking about when I was in my late teens and, just in college. And so I didn't have the level of scientific literacy that you're talking about where I was questioning everything and going straight to the data to explore all of these things. I was just reading health books and, assuming that if, my mentor who I respect, who wrote this book is talking about adrenal fatigue, of course, it's got to be real.
Did you just stumble across something that said otherwise? Or maybe there wasn't a memorable shift in the track, but
I don't remember exactly where, but I remember stumbling across something where some kind of conventional medical doctors were talking about how adrenal fatigue is quackery. And it really actually irked me. And so it's kind of ironic how we arrived here, but it irked me so much that these conventional medical doctors were brushing off the whole adrenal fatigue hypothesis as pseudoscience that I had this idea that I was going to go dig into the science, explore all the literature, and prove that adrenal fatigue actually is a real thing and is supported by good evidence.
Got it.
And when I started to do that, I just started to discover that the evidence actually doesn't really support it. And there's a huge amount of contradictory data, and there's really no good evidence to support the basic idea of adrenal fatigue. So then I started digging deeper and deeper and deeper. And literally this was 6 months, almost a year of just digging into this literature, trying to make sense of it all, because there's so much contradiction. So that's what got me here. And I eventually published all this giant review of the literature. I basically said, you know what, I'm not going to try and summarize. I'm not going to try and prove adrenal fatigue is real or isn't real. I'm just going to say, here's the actual data. Literally, here's the list of every single study that's been done on this subject of exploring the relationship of cortisol levels and fatigue syndromes. There's about 59 studies, individual studies in total, and from 1995 through 2019. And there's 20 different literature reviews where other researchers have gone and compiled the literature on, usually it's on one particular fatigue syndrome. So let's say the 20 studies on burnout syndrome or clinical burnout, or the 12 studies on stress-related exhaustion disorder, or the 25 studies on chronic fatigue syndrome, et cetera, et cetera. So there's 20 literature reviews like that. And basically I said, I'm actually just going to list out all of this data online publicly, and with the actual screenshots of the cortisol curves where they're testing people with fatigue syndromes versus normal healthy people, and the names of the studies and so on, and the conclusions, the actual quotes from the researchers of the people who are conducting these studies. And if people go to theenergyblueprint.com/is adrenal fatigue real, there's nothing you got to opt in for or anything like that. I'm not trying to get your email or anything.
We'll get that link in the show notes for the listeners there.
Yeah. So basically I list out all of these studies, and here's what it looks like. So I won't go through all 79 of them, but I want to give you kind of a sampling of what this looks like. If people go to that page, the lists of studies are in chronological order. They start in 1995. I'm not going to read all the names of the studies because they're things like neuroendocrine responses to diphenfluramine and insulin-induced hypoglycemia in chronic fatigue syndrome, and neuroendocrine assessment of serotonin function in chronic fatigue syndrome, and diurnal variation of adrenocortical activity in chronic fatigue syndrome, and so on. So basically, 1995 study found no significant differences in cortisol between those with chronic fatigue syndrome versus normal healthy people. Another one from 1995, no significant differences in cortisol between those with chronic fatigue syndrome versus normal healthy people. Two more from 1997, 1998, same conclusion. Another one from 1998, slightly lower morning cortisol levels in people with chronic fatigue syndrome. Then we get into like 1999, and we start to see, another one from 1998, slightly higher cortisol levels in people with chronic fatigue syndrome. And if people actually look at the screenshots, one thing I want people to know is that kind of gets lost when you summarize it by saying slightly higher or slightly lower. If you actually look at the lines where they're charting the cortisol levels in people with chronic fatigue versus normal healthy people, in many cases, the lines are literally indistinguishable. They're right over one another. They're barely statistically significant, barely discernible where they even separate because the actual levels are so close. So we're talking, even when a study finds slightly higher, slightly lower, the vast majority of them find minute differences in cortisol levels. There are a few where that's an exception, but the vast majority find very small differences, and people will see that if they look at the screenshots. So 1998, slightly higher cortisol levels in people with chronic fatigue syndrome, and 1999, slightly lower. 2003, no difference. 2003, people with burnout versus normal healthy control, slightly higher morning cortisol, normal cortisol levels the rest of the time of the day. On and on and on, like this, basically slightly lower, slightly higher, no difference, no difference, no difference, slightly lower, slightly higher, and I could give a number of quotes here. So for example, in 2006, there's one titled "Clinical Burnout is Not Reflected in the Cortisol Awakening Response, the Day Curve, or the response to a low-dose dexamethasone suppression test. They concluded, this is a quote, and you can actually look at the screenshots. This is an example where the lines are literally indiscernible. You cannot tell the difference between the cortisol curves of people with burnout versus normal healthy people. They said HPA axis functioning in clinically diagnosed burnout participants, as tested in the present study, seems to be normal. I could go on and on and on. Here's another one where they found, for example, high morning cortisol is associated with fatigue and burnout. They did a rhodiola rosea intervention and found that it lowered morning cortisol levels, and that the lowering of morning cortisol levels correlated with improvement of symptoms. Number of other ones with almost identical cortisol curves between the two people. And again, these results of these individual studies, I mean, if you look at these pages, if you look at this page on my site and you actually look at one study to the next, to the next, to the next, they're all basically totally conflicting as far as the results that they're finding. They're literally finding the opposite results from one study to the next.
Did you find there was a window of time in which this was a hot research topic? Has that persisted, or was there like a time in which that was really looked at hard and now that's moved on? Or like, what are your thoughts about the trends that way?
It does seem to be that case. I mean, there's still reviews of the literature. The one from 2016 that was titled "Adrenal Fatigue Does Not Exist." There was another one in 2018 or 2019 that was published kind of by a couple of endocrinology experts that were saying we're sick of. I think it's called "We're Tired of Adrenal Fatigue." So there's still stuff like that coming out. There's a 2017 systematic review titled, what was it? I know that you're familiar with this one. Diurnal cortisol slopes and mental and physical health outcomes, a systematic review and meta-analysis. And that one's more broadly, not specifically on fatigue, but it's on a variety of different, I think 12 different health outcomes and symptoms. But yeah, from what I can see from 1995, really through about maybe 2010, it seems to have been a hot topic. And if you actually just really analyze that research, and researchers did, so there's 20, I also have this on that page I mentioned, there's 20 systematic reviews. The first one I found was from 2001, a systematic review of the neuroendocrinology of chronic fatigue syndrome and fibromyalgia. And then 2003, 2004, and all the way up to 2015, 16, and 17. So here's ultimately how the numbers actually break down. The summary from these 59 individual studies. 15 of the 59 studies give evidence for slightly lower morning cortisol levels in people with chronic fatigue syndrome or fibromyalgia or burnout syndrome or stress-related exhaustion disorder. Okay, so 15 of 59, 11 of 59 found the opposite finding, slightly higher morning cortisol levels. And 33 of the 59 showed no significant difference whatsoever in cortisol levels between people with full-blown chronic fatigue syndrome or stress-related exhaustion disorder or clinical burnout and normal, healthy people. There was a nice study in 2001 looking at specifically chronic fatigue syndrome, where they concluded 1/3 of the studies that they reviewed reporting cortisol levels found it to be significantly low, usually in 1/3 of patients. So here's what's interesting. When you look at the statistics, on average, there's enough people in this segment of about 1/3 of people with chronic fatigue who have usually it's lowered morning cortisol level or a flattened diurnal curve of cortisol level. It's almost never, by the way, actually low 24-hour output of cortisol. So there's no real sign that the adrenals have been worn out and are unable to produce enough cortisol. What we're really seeing is there's a disturbed rhythm as far as the release of the cortisol. And oftentimes that's a lower morning level and sometimes a higher evening level as well, though not all studies show that. Some, as I mentioned before, the studies are wildly contradictory. But if you analyze the statistics, there's enough people in that 1/3 of people who are in the direction of lower morning cortisol levels to skew the overall average of the data such that you can say, on average, people with chronic fatigue were in the direction of lowered morning cortisol levels. But what's interesting is if you do the statistical analysis another way, as I just said with a quote from that study, you realize that 70% of people with fatigue don't have low cortisol levels. The vast majority of people with fatigue do not have an abnormality in the direction of lower cortisol levels or lower morning cortisol levels. They either have perfectly normal cortisol levels that are indistinguishable from normal healthy people, or even high morning cortisol levels. So there's two different ways of kind of producing some statistics around this that can lead you into different directions. I will say, even if you analyze the data such that you conclude, statistically speaking, people with fatigue syndrome lean in the direction of slightly lower morning cortisol levels. The effect size is tiny, again, because 70% of people with fatigue syndromes do have either perfectly normal or high cortisol levels. So that's how the literature breaks down. There's basically zero indication that any of these fatigue syndromes are actually are reliably and predictably linked with a clear low cortisol pattern. You can have people with full-blown chronic fatigue syndrome, fibromyalgia, stress-related exhaustion disorder who have perfectly normal cortisol levels that are indistinguishable from normal healthy people. And in fact, the majority of people with those conditions do have that.
So a question that I've seen come up is, what about vice versa? Is there a predictive value of those that are, because for example, with fatigue, there can be many different causes, and it's easy to say that there's not a single cause of fatigue. You could make that argument against Epstein-Barr or anemia, things that could be contributors in some cases, but are not across the board. Is there data arguing that those that have abnormal cortisol slopes or rhythms are more apt to be symptomatic, as opposed to the opposite?
Yeah, so that's a good question. From what I've seen, there is a very weak correlation between that. I think overall, there is a case that the segment of people that do have lowered cortisol in the morning, that absolutely can be a contributing factor to their symptoms. So I think that's a very reasonable way of interpreting it, but it's so different from the claim of adrenal fatigue that it is the wearing out of, chronic stress wearing out your adrenal glands that's causing all of these symptoms. That is absolutely just flatly not true. And there's a variety of interesting layers of evidence that we could look at to see to what extent the symptoms correlate with cortisol levels. So there's a few of these 59 studies, 10 of them were longitudinal studies where they actually tracked changes in cortisol levels and tracked people's symptoms. So they looked at to what extent different interventions, in many cases, whether it was a meditation intervention or a cognitive behavioral therapy intervention or a sleep intervention or psychotherapy or whatever it is, various kinds of interventions or rhodiola rosea intervention, they looked at to what extent people improved over time, over the course of 3 months or 8 months as a result of those interventions, and how the improvement of symptoms tracked with changes in cortisol. So let me just find a few of these examples to share with you.
And one quick point to throw out in support of what you're saying is that there was one paper I saw, which is rather obscure, that looked at, I don't remember what the criteria was, but it was something about the effect of glucocorticoid replacement in these cases. If giving someone exogenous pills of hydrocortisone, if that would improve symptoms in some of these fatigue states that did have low cortisol. And it was a favorable paper, and they used a improvement in fatigue to, try to like almost retrospectively confirm the theory that people felt better. Therefore, this must have been really the reason they weren't feeling well. And the pitfall is that, there's many cases to where hormones or nutrients can act like non-specific stimulants, and things that may improve fatigue in the short term may not be congruent with the real cause of the fatigue, and also may not be conducive to a longer term arc of better health.
Yes, exactly. And actually, to that point, there's you may or may not know this, but there's actually a number of pro athletes, like endurance athletes. For example, endurance elite, biking athletes on the Tour de France who will inject or take cortisone. I think usually hydrocortisone before their races, because it is a genuine performance enhancer. So and there's actually studies confirming that it enhances athletic performance. But as you know, as we've talked about, the use of those kinds of medication over time create a lot of different nasty side effects. So, and those are some of the studies of these 10 intervention or longitudinal studies that I want to mention. But just to mention a couple of them, one is from 2006. You can find it on that page, theenergyblueprint.com. Is adrenal fatigue real? It's called Cortisol Deviations in People with Burnout Before and After Psychotherapy. And this one, they found no connection between cortisol changes and symptom improvement from the intervention study. Another one from 2006, a longitudinal study on cortisol and complaint reduction in burnout, was an 8.5 month intervention study that found that recovery from burnout has no relationship with cortisol changes. I got to kind of scan through here to find the other one. I mentioned the one with rhodiola rosea, where they found, this is one of the 3 of the 10 that found some kind of relationship between cortisol changes and changes in symptoms. They found kind of counterintuitively that lowering morning cortisol levels from rhodiola rosea was linked with improvement, which again doesn't really mesh with the adrenal fatigue theory at all. And then, as you alluded to a minute ago, or mentioned, I should say, there were actually 3 studies that used hydrocortisone or fludrocortisone, some kind of cortisone medication in people with, all 3 of them are in chronic fatigue syndrome, and assessed whether they created improvement. And the first 2 from 1998 were kind of positive, and then it was tested again in 2001 with a 6-month randomized crossover trial, which means the same people who were getting the placebo originally were then switched for the second 3 months to the cortisone, and the people who got the cortisone in the first 3 months were switched to placebo, which basically, in other words, a kind of study that's pretty much as good as a randomized controlled study gets. And what they found is that the cortisone medication was no better than placebo. So that was the last study on that topic from about 2001, which begs the question, why hasn't that been further studied, right? And the answer is because the research didn't really support it. So, some of these systematic reviews I'll just mention real quick, for example, on burnout and cortisol levels. This is a quote from the researchers who did this research review of 19 studies. They said, quote, when taken together among all the studies that investigated HPA axis function and burnout, 3 support an increase in HPA axis functions and burnout, usually higher morning cortisol levels. 5 support a decrease in HPA axis function, slightly lower morning cortisol levels. And 11 of the 19, the vast majority of studies, did not support any relationship whatsoever. Then they concluded, the pioneering studies that focused on the relationship between burnout and dysregulation of the HPA axis have yielded inconsistent results. Data from subsequent studies with improved designs suggest there is no HPA axis dysregulation in burnout. So there's another one, the HPA axis and the genesis of chronic fatigue syndrome. So now it's chronic fatigue syndrome instead of burnout. The researchers concluded recent prospective studies of high-risk cohorts suggest there are no HPA axis changes present during the early stages of the genesis of fatiguing illness. In other words, and actually just to add another layer to that, they actually said a reverse direction of causation, that the illness leads to HPA axis change rather than the other way around, is supported by the findings that there's an apparent absence of HPA axis changes early in the genesis of chronic fatigue states, and that modifying cognitive behavioral components of the illness normalizes the HPA axis. So in other words, what they're suggesting is abnormalities in adrenal function and HPA axis function can't be, quote unquote, the cause of this condition if there are no reliable abnormalities present in the majority of people when people first start to develop chronic fatigue. But interestingly, they go on to say that this reverse direction of causation, that many people, once they have these conditions, can develop HPA axis dysfunction, which is a whole different avenue we can discuss of why
I'd love to touch on that. I think it's straightforward that cortisol is not the sole cause of fatigue or burnout, and that's something that hopefully people can let go of. The one last point on glucocorticoid replacement therapy, it's sadly still really popular in natural or functional medicine. And the negatives about it being perhaps not more effective than placebo are real, but it's something that people often have a hard time discontinuing, even if they wish to. There can be a real suppression of their own output, and they can have very, very real symptoms from trying to withdraw or taper from that. So it's a good thing for people to be wary of.
Yes, indeed. Yeah, I agree 100%. And I see in, some of the people who have had resistance to what I've just explained and what I've outlined on my website, and some of the functional medicine practitioners who use cortisol and swear by it, or cortisone medication, they really have resistance, and they swear, but I've seen so many people improve from this.
Right.
And it's like, well, great. I also see a lot of people who say they've been on it for 10 years and are now suffering horrible side effects from being on it. So
Right.
I don't doubt, as you pointed out earlier, that in many cases you can observe kind of a stimulant effect and instantly get some improvement. But I think in the long term, the research is clear that it's not helpful. And interestingly, in those intervention studies, they actually segmented out specifically the people who actually had, among these people with chronic fatigue syndrome, the segment of people that had low morning cortisol levels, and analyzed whether those specific people got more benefit than the other people with chronic fatigue that didn't have low morning cortisol levels from the
I would guess not.
hydrocortisone. And they found that even those people had no more benefit than placebo.
So what were some of the conclusions you gained about just the relevance of HPA slope and HPA stability as being a predictor of longer term health outcomes?
Yeah. So again, statistics are really interesting. So there's a 2017 systematic review titled Diurnal Cortisol Slopes and Mental and Physical Health Outcomes, a systematic review and meta-analysis. And they analyzed 12 different factors, symptoms, and conditions. So anxiety, cancer, cardiovascular disease, depression, the psychological trait of externalizing or internalizing. They analyzed immune and inflammation outcomes. They analyzed fatigue. I will point out that they only included 8 studies on the subject of fatigue of the existing 59 studies. So keep in mind that probably on all these other conditions, they're probably citing a very small segment of the overall literature. So the extent to which something like this is really drawing that meaningful conclusions when they're not actually evaluating the whole body of data is very questionable. But so fatigue, cardiovascular disease, obesity, other mental health, and other physical health problems. And what they concluded was that there is some genuine correlation that you can say there's a statistical correlation between a flatter diurnal cortisol slope and worse health outcomes on these 12 different things. Okay, so a study like this can, when you cite it like that and you make a statement like that, can sound really sort of conclusive and authoritative. But here's what's interesting. So the overall effect size across all health outcomes was 0.147. For people who don't know, the effect size, there's a variety of different ways of statistically doing this, but in this case, they're using a scale from 0 to 1, or actually -1 to +1.
Mm-hmm.
And 0 is basically no correlation at all. A 1.0 is a extremely strong, very predictive relationship. So you have a very direct relationship between, if somebody has, for example, this level of testosterone, they're likely to have a really strong libido, versus if they have this level of testosterone, they're likely to have a really weak libido. And you can predict that very, very reliably from looking at these testosterone numbers. I'm just making up a hypothetical example. In this case, on this scale of, let's call it 0 to 1, the effect size was 0.147, which anything below 2 is considered a very, very small effect size. They even note that their effect size that they found was larger than the previous one by researchers Chida and Steptoe from a similar review of the literature in 2009. And then they said, it's slightly larger than that one, maybe due to some publication bias among the researchers, but they acknowledge this effect was very small on average. And to talk specifics, so some of these conditions, they actually list out the correlation for each different individual condition. So let's look at fatigue, for example. It's 0.167, below 2, below 0.2, which is a very small correlation. That's basically exactly what you would predict based on the overall research that I just explained, where it's so divergent, it's so heterogeneous that you have so many studies showing completely opposite findings. But on average, there's some at least segment of the population that has at least slightly lower morning cortisol levels. So you can say statistically, yes, there's a correlation there, but it's still the case, from another way of analyzing the statistics, that 70% of people with fatigue do not have that cortisol or abnormality. So, basically that's, I think that there's absolutely some link between HPA axis dysfunction, of course there is, and a flattened diurnal curve and various negative health outcomes. Actually, where the strongest research is, the most consistent by far, if you look at cortisol levels in all kinds of different diseases and all kinds of different chronic stressors, and I've compiled everything from cortisol levels in people with chronic pain to cortisol levels in people who are chronic cigarette smokers, to heavy drinkers, to work stress, to unemployment stress, to relationship stress, to financial stress, to specific diseases, cardiovascular disease, depression, anxiety, schizophrenia, post-traumatic stress disorder. The list goes on, obesity and diabetes, and et cetera, et cetera. The absolute strongest by far link is with elevated cortisol levels, just high cortisol levels, high in the morning, oftentimes high in the evening, or normal in the evening. But that is absolutely linked with a huge array of different diseases. And we have lots of good research on the mechanisms as well to show that high cortisol levels can drive insulin resistance, can drive gut permeability, can drive brain degeneration, can drive chronic inflammation, chronic immune suppression. It can drive all kinds of nasty effects. And I absolutely think that high cortisol levels is a huge problem. I think flattened diurnal cortisol levels also probably linked, almost certainly linked, at least to a small extent, with a variety of negative health outcomes. But I think for sure high cortisol levels is definitely linked with a huge array of negative health outcomes. The one thing I just want to point out here is none of this research supports anything to the effect of adrenal fatigue.
Right.
None of this actually relates back to that and gives any support to the adrenal fatigue theory.
One last quick point. Did you come across the Whitehall study at all? The Whitehall 2 study?
Yes. Is that the one, a community-based cohort?
It was British civil servants that were tracked.
Yeah.
It was basically showing that the cortisol slope ended up being one of the strongest predictor of mortality, and I think the second strongest predictor of cardiovascular mortality. And they compared that against smoking, obesity, cholesterol, all sorts of things. And
so say that again. You're talking about a flattened diurnal curve?
They actually just defined it as abnormal. So if it were flattened or backward, that would all be considered just abnormal.
Yeah, I mean, if you include just elevated cortisol levels,
right?
Then,
and that would
under that heading of abnormal, then absolutely there's a huge amount of data linking elevated cortisol to all kinds of negative health outcomes.
Yeah.
So the one thing I will mention is low morning cortisol levels are a real thing. I'm not saying that they're not real. A flattened diurnal curve, low morning cortisol levels are a real thing. Interestingly, I've done a deep analysis, and I know we only have a few more minutes, so I actually have like an hour lecture on this topic, so I'll try and summarize that in like a minute and a half. But if you look at what actually is linked with low morning cortisol levels, the vast majority of different types of stress, so all those different types of stressors, cigarette smoking to chronic pain to overtraining physically with exercise to all kinds of different kinds of psychological stress, they're almost never linked with low morning cortisol levels. They're very, very consistently linked with elevated morning cortisol levels. There's a couple things, though, that are very consistently linked with low morning cortisol levels. And those are circadian rhythm disruption, sleep disruption, and being a night owl, which relates to circadian rhythm as well. So interestingly, there's about 5 or 6 studies where they've looked at just cortisol levels among people with different chronotypes. So not even fatigue or no real symptoms, no health problems, just normal healthy people who are either morning people or evening people. And the people who are night owls have literally about half the morning cortisol levels that morning people have. So just that one factor, you can have 0 symptoms, you can have perfectly good health, but just going to sleep late and being a night owl will literally, on average, cut your cortisol levels in the morning in half to an extent, to such a significant degree. And I mentioned all these other studies on like different fatigue syndrome where the effect size is tiny. Here, it's actually a huge effect size, literally about half the cortisol levels. So it's to such an extent of a decrease in morning cortisol levels that if those night owl people went to a doctor who believes in adrenal fatigue, they would almost guaranteed walk away with a diagnosis of adrenal fatigue, even though they may not have any symptoms whatsoever. They're normal, healthy people, but they do have a level of morning cortisol levels that someone who believes in that hypothesis would say, "Oh, wow, you've clearly had years of chronic stress that have worn out your adrenals." When in fact, that's not what the research says at all.
Well, this has been great. Yeah, thank you for the time to put into this. It's funny how one can get obsessed on a topic and go so deep with it. I completely resonate with that and respect your efforts. So yeah, thank you for getting us up to speed on your work.
Yeah, thank you so much for having me, Alan. It was really a pleasure, and I enjoyed this conversation very much.
Always good to hang out, and look forward to talking again soon.
Likewise.
And listeners, yeah, thanks for tuning in. We're going to get the links up there, and we'll get all the guidance to find the studies Ari was citing and get you more access to his training and information. But thanks for being here, and take great care. We'll talk to you soon too. Bye-bye. Hey, Dr. Christianson here. Thanks so much for joining me for another episode. Is there a topic you'd like me to cover? I'd love to hear from you. Just go to Dr. Alan Christianson on Facebook or Instagram, write your question, and use the hashtag #MedicalMyths. Did you find this show helpful? If so, please take a minute and leave us a rating on iTunes so that others can know. Thanks much, and I'll be back with you real soon. Bye-bye.